Consent, Mr. President, to vacate the quorum call.
Without objection.
Mr. President, I have some remarks to make with respect to health care that I'll offer in a moment. But first, I want to address the events of this morning. The shooting that took place in Alexandria today was a horrendous, despicable act of violence. The victims, including Congressman Scalise, 2 Capitol police officers, and 2 others, are still undergoing treatment. There is much that is still not known about what happened. There are a few things that are known. First, it is thanks to the extraordinary heroics of the Capitol Police and first responders on the scene that this shooting did not become a massacre. Each and every one of us who comes to work in these buildings every day is profoundly grateful for our Capitol Police, our first responders, and the incredible service and protection that they provide. Second, I think all of us know that this violence has visited too many of our communities. It has cost and ruined too many lives. And finally, we know that the game our colleagues were practicing for, a charity game between rival parties that's held to benefit disadvantaged kids, is going to go on as planned. The game is a show of friendship. It's a show of bipartisanship. It's an indication that as there are strong differences of opinion on the policies that we debate here on the floor of the Senate, we still come together at urgent times like this. And the game, which shows our commitment to friendship and bipartisanship, has never been needed more than it will be tomorrow. Our thoughts are now with those who are injured. It seems that everyone you run into here in the Capitol has said that they're praying, they're rooting for a full and speedy recovery. And it's one of those moments, Mr. President, when people understand that there's legislation here, there are bills, there are amendments. Sometimes there's a lot of process. An amendment to the amendment to the amendment, as my wife calls it. Then there are other times, like this morning, that are life and death. And as we reflect on those who did so much to keep it from being even worse, a massacre, and have our prayers for those who are injured, it once again puts into perspective what is so very important. Now, Mr. President, to the topic at hand. There have obviously been dramatic headlines in the news pertaining to ties of the president with Russia. And I want to be sure that what's happening here in the Senate with respect to health care doesn't get drowned out. The fact is, here in the Senate, behind closed doors, 13 senators, all from the same party, all of the men, are updating the Republican health care plan. The House passed its Trumpcare bill by the slimmest of margins just a few weeks ago. The public has seen it, and based on everything I can tell, Mr. President, it's gone over about as well as prolonged root canal surgery. I've heard about every imaginable concern about that House bill from Oregonians. I've had 46 town hall meetings thus far this year, including 4 over this past weekend. So when the bill came here to the Senate, my colleagues on the other side got out in the press, tamped down expectations, and claimed that everything would be starting over. They're starting from scratch. Now the public knows, because it is what members of the majority party have said, that the Senate version isn't going to be all that different from what barely made it from the House this spring. When the bill is finalized, we know it's going to be rushed to the floor, and it won't be long before debate is cut off and that final votes are cast. It's a plan that relies on speed, forcing a devastating blow to American health care through the Senate before our citizens can actually catch on to what's happening. This political process on this bill makes what the House has been up to look positively transparent. And the basic framework of the Republican health care plan isn't going to change. Millions and millions of Americans will lose their health coverage. Not my view. It's the view of the independent Congressional Budget Office. Costs are going to go up, especially for those who are elderly and sicker. And those who are the fortunate few are going to get an enormous tax break. The basic framework isn't changing, and what that means is the social safety net led by Medicaid, which is a lifeline for kids and seniors and the disabled. That safety net is going to be under attack. The public health system in America has stood on 2 twin pillars since 1965. Those pillars are Medicare and Medicaid. And the majority, the Republican majority here, has a plan to knock one of them out beginning this year. Today, Medicaid comes with a guarantee that if you're sick, if you're injured, or if you spend every day walking an economic tightrope, you're going to be able to get care when you need it. You won't be denied benefits. But Trumpcare ends that guarantee. The plan Republicans have on offer would dismantle Medicaid as it's known today, putting hard dollar limits on the program that put caps on care. That's what it means, Mr. President, that there be caps on care. It's a scheme that puts Medicaid in a vice, squeezing its funding year after year. The plan makes budget targets a bigger priority than real-world health care needs of some of the most vulnerable people in our country. 74 million Americans have health coverage through Medicaid. That includes 37 million children. It provides comprehensive care to millions of pregnant women. And it's a leader in the fight against the opioid epidemic. And there's treatment for those who are dealing with mental health and substance abuse disorders. Medicaid is a lifeline when it comes to helping kids and adults with disabilities. And then there's a nursing home benefit, something I know, Mr. President, from my years as co-director of the Oregon Gray Panthers. This is a benefit that is bedrock protection built into Medicaid that helps pick up the tab for 2 out of 3 nursing home beds in America. You roll that benefit back, Mr. President, and I don't see how seniors across this country are going to avoid living in squalor. maybe their kids can take them in. But the kids of parents that I'm talking about have told me they're walking on an economic tightrope, trying to balance the food against the fuel costs, and the fuel costs against the rent costs. So my guess is, if you squeeze the Medicaid program tighter and tighter and tighter, and states are forced to cut benefits and access to care, as will be inevitable under Trumpcare, I just don't see where you can ensure that seniors in nursing homes are going to be protected. My own view, and this goes back to the days, as I say, Mr. President, when I worked with seniors, the challenge with older people, the challenges have evolved over the years. Back then, you had Part A, that was hospitals. Part B, that was doctors. Today, that's not Medicare anymore. Today, more than 90% of the spending deals with chronic illness, cancer, diabetes, heart disease, strokes. It's a very different program. But we're still going to need nursing home care for so many of our older people who have, Mr. President, done everything right in life. They're our mothers, our fathers, our grandparents, our friends. They fought our wars, they started families, they built careers, they raised kids, they scrimped, they saved. They never went on that special vacation. They never bought the boat they would have loved to have. And they did it because they always wanted to pay for essentials and see if maybe they could set aside what they could for schooling for kids and retirement for themselves. But Mr. President, as I've said, what I've seen over the years since those Grey Panther days is growing old in America just keeps getting more expensive for so many older people. The bills don't stop coming when you retire, and most older people still live on a limited fixed income. I saw that when my full-time work was the legal aid office for older people and the Grey Panthers, and I saw those seniors having to stretch every last penny. And even then, it was a struggle to cover the basics. So what happens, and I'm afraid we're going to see a lot more of it, is seniors eventually spend down their savings. And so then they face challenges when they've spent down their funds. Today, when it comes time to pay for long-term care like nursing homes and home-based care, Medicaid steps up. It is the backstop, the guaranteed backstop to protect our senior citizens. And I don't want to undersell how much that means to people in my state and across the land. Medicaid is the barrier that keeps millions of seniors from falling into isolation and utter destitution. There was a time in our country when seniors were cast aside. They were sent to poor farms, what were called almshouses. The wealthiest nation on earth, the freest, wealthiest nation on earth, said goodbye to those poor farms with the creation of Social Security, Medicare, and Medicaid. Under the Republican health care plan, unfortunately, Medicaid would be slashed so deeply, states are going to be forced into cutting benefits. Seniors could be nickeled and dimed for basic everyday services. Nursing homes could be shuttered. Home-based care that allows seniors to live independently could be no more. I think you're going to have lots of seniors living in squalor, and some could be out on the street. So in my view, the people of our country are owed answers to key questions about this Republican plan. First, how are families supposed to support their loved ones if they lose the guarantee of Medicaid? 1 year in a nursing home costs more than $90,000 on average. That's 2 or 3 times the cost of a year of college tuition. Are families going to be forced into choosing between educating their kids and supporting their elderly parents? Is it going to be a fact of life for working Americans that they have to cram 2, 3, or 4 generations of one family into the same house simply because they can't afford nursing home care? Second, what's the backup plan for vulnerable, isolated seniors, particularly those who live in rural areas? I recently held a series of 8 healthcare roundtables in rural communities across Oregon. Just over the last few days at home in Pendleton and Condon. The message I heard from healthcare providers again this past weekend throughout rural Oregon was the Trumpcare cuts could hit seniors in rural America especially hard. Seniors in rural communities, Mr. President, have higher rates of chronic illness like heart disease and diabetes. The health care they need requires more attention and more service. They count on getting top-notch care in nursing homes and from home-based providers. Losing these benefits could mean being alone in a home that's unsafe, cut off from the care and the connections they need. Colleagues, in the last few weeks of this debate, I've heard members flatly deny that gutting Medicaid by more than $800 billion will mean anybody loses access to health care services. That is just untrue. Anybody who says that they can slash our health care programs by close to $1 trillion without having negative impact on access to health care services is just plain wrong. And furthermore, I think it's time to recognize what the end goal of this debate appears to be. My Republican colleagues haven't put forward a proposal to protect seniors who can't get the Medicaid nursing home they need or kids with disabilities who lose the services they depend on. What Republicans have on offer is not a plan that swaps one vision of health care for another. These massive cuts to Medicaid and other health programs are going to pay for equally massive tax breaks for the fortunate few. Members of this body are going to have to decide whether it's worth gutting Medicaid and endangering the essential care like the nursing home care and important home-based services to pay for these big tax breaks for the fortunate. In my view, it should be an easy choice. My colleagues on the other side ought to drop this partisan approach, what's called reconciliation, that it seems the Senate is headed towards. At a minimum, the majority party ought to bring this process out from behind closed doors and give it a little bit of sunlight. There ought to be hearings convened in the Finance Committee and the other committees of jurisdiction, as there were again and again in 2008 and 2009. I don't see how, when you're talking about 1/6 of the American economy, what is the premier issue, and always will be, are people and their loved ones having their health, I don't see how you make an argument for not having a debate out in the open. There has to be a public debate. The legislation ought to be written in the light of day. And then our people ought to have ample time to review it before it goes up for a single vote, either in committee or here on the floor. And I'm going to close, Mr. President, in terms of something that I especially think about today. the big challenges of our time. You've got to deal with in a bipartisan fashion in order to, one, get them right, and two, make them sustainable. The President of the Senate knows this. He and I have spent many months working on key economic issues, recently put together a bipartisan bill on infrastructure. Health care is particularly important because when you're talking about providing care for over 300 million Americans, you've got to really think through what the consequences are, and often when you take a step over here, it ripples up over there. And that's why it seems to me that it's so important that the Republican majority set aside this partisan our way or the highway approach and get back to working together to find common ground. I had a piece of legislation when we were debating health care in 2008 and 2009. 8 Democratic senators, 8 Republican senators. First time in the history of this body that we had that. There are Republicans and Democrats who continue to serve in this body who are co-sponsors of that legislation. It's called the Healthy Americans Act. We got some of what we thought was important into the Affordable Care Act. In particular, a provision that I think the American people really want to think about in the days ahead, and that is, in our bill with the 16 senators, we had airtight, loophole-free protection for those with pre-existing conditions. There wasn't any way to hit them with extra costs, discriminate against them because they had a pre-existing condition. And we said that we wouldn't stand for that because if you allow discrimination against those with pre-existing conditions, you take America back to the days when health care was for the healthy and wealthy. If you're healthy, don't have a pre-existing condition. If you're wealthy, you can pay for care. We can't go back there. But the House bill basically allows states to get waivers so they could start unraveling that and punch big holes into that guarantee of airtight protection for those with pre-existing conditions. And if the majority will set aside this partisan only, we're doing it our way kind of approach, what you've heard from colleagues on my side is that there is very, very significant interest in working together to deal with the key challenges. One of them, obviously, is more competition in the insurance markets, particularly as it relates to individual insurance. You do that, and you take the insurers off this roller coaster so they have some certainty and predictability. You can stabilize the private insurance market. We ought to work together on bringing down prescription drug prices. Our people tell us every time we're home that these prescription drug price increases are hitting them like a wrecking ball. I've introduced approaches that I think can get bipartisan support, and there are others who have as well. But that's how you do it right. That's how you find common ground, is you take time to take each other's good ideas. Bipartisanship isn't about taking each other's lousy ideas. Bipartisanship is about taking each other's good ideas. And they're good ideas on both sides of the aisle to stabilize the private insurance market, to hold down prescription drug prices. But this idea of reconciliation, where we're all just going to do it our way, that's the Republican approach, the partisan approach. And featured in that approach is devastating cuts to Medicaid. That is a non-starter. So I come to the floor this afternoon, Mr. President, particularly given years of interest in trying to find bipartisan common ground on health care, to urge my colleagues to abandon this approach that's being pursued behind closed doors, that nobody knows anything about, that really seems unprecedented in terms of dealing with a sixth of the economy. I urge my colleagues to abandon the partisan approach of reconciliation, work with colleagues on this side on a bipartisan basis. And I close simply by way of saying I wanted to come to the floor today. I'm going to try and be back tomorrow to outline other challenges ahead in health care. And I urge the American people across this country, in every corner of our nation, to make their voices heard. I yield the floor. And Mr. President, I note the absence of a quorum.
Clerk will call the roll.